If you keep drinking water and you still feel off, it might not be a water problem. It might be an electrolyte problem. That sounds small, but it changes what your body can actually do with the water you drink. Electrolytes are minerals that carry electrical charge. Sodium, potassium, magnesium, calcium, and chloride. They help move fluid into the right spaces, fire nerves, and contract muscles. So if you dilute them, you can end up feeling weak, headachy, foggy, crampy, or just weirdly tired, even though you are doing the so-called healthy thing and chugging water. And no, this is not about fancy sports drinks. It is about recognizing patterns. When symptoms show up, what you were doing before they started, and what makes them better or worse. Over the next few minutes, you will get a practical checklist, not a diagnosis, just a way to tell when more water is likely the wrong lever to pull. Moving to slide 2. Here is the simplest mental model. Your body is basically managing two things at the same time: water volume and mineral concentration. Water is the volume. Electrolytes are the concentration. When you sweat, you lose both. When you drink plain water, you mostly replace volume. So if you replace volume faster than you replace minerals, you dilute the concentration. Sodium is the big one for fluid balance outside cells. Potassium is a major player inside cells. Magnesium is involved in muscle relaxation and nerve signaling. Calcium helps muscle contraction. Chloride tags along with sodium for fluid and stomach acid. Your kidneys try to keep all of this stable. They can dump extra water or conserve it. They can hold on to sodium or let it go. But that system has limits, especially if you are sweating a lot, drinking huge amounts, or eating very low salt. So the question is not, is water good? It is water alone matching what you are losing? Moving to slide 3. Let's talk about the most common clue. You are thirsty, so you drink. Then you are still thirsty. Or your mouth feels dry, but your stomach feels slushy. That mismatch is a hint. Thirst is not only about water. It is also about sodium concentration in your blood. When sodium is low relative to water, your body may not fix the signal by adding more water. In fact, adding more water can push you further in the wrong direction. Another pattern is frequent clear urination after heavy drinking. If you are peeing a lot and it is very pale, you might be overdoing water relative to electrolytes. That does not automatically mean danger. It just means your body is trying to dump the excess volume. A practical check. After a long sweaty session, if plain water makes you feel bloated or nauseated, but a salty snack and moderate water makes you feel normal, that is a strong electrolytes might matter signal. Again, we are looking for patterns, not one-off moments. Moving to slide 4. Headaches are tricky because there are many causes, but there is a specific headache pattern that often shows up with electrolyte imbalance. It tends to happen after heat exposure, long exercise, sauna, or a day where you drank a lot of plain water. You might notice pressure, mild nausea, or light sensitivity, and it can come with fatigue that feels like your batteries are drained, not like you need motivation. What is going on? When sodium concentration drops, fluid shifts can affect how you feel, including in the head. Also, if you are low on electrolytes, your nervous system can feel glitchy. Not dramatic, just off. A useful contrast. Dehydration headaches often come with obvious thirst and darker urine. Electrolyte-related headaches can happen even when you are drinking plenty and your urine is pale. If you notice that a small salty meal, broth, or an electrolyte mix with water helps more than plain water, that is a meaningful clue. Still, headaches can be serious for other reasons, so treat this as a signal to pay attention, not to self-diagnose. Moving to slide 5. Muscle cramps are the symptom everyone associates with electrolytes, but the reality is more nuanced. Cramps can come from fatigue, pacing, tendon load, and hydration. Still, electrolytes are often part of the picture. Here is the pattern that raises my eyebrow. You cramp after long sweating, especially in heat. The cramp is sudden and intense, and it tends to repeat in the same session, even if you stretch. Sodium lost through sweat can change how nerves fire and how muscles contract. Magnesium and potassium also play roles in muscle function, but sodium is usually the main issue during heavy sweating. Another clue is twitchiness. Not a full cramp, just small muscle flickers in calves or eyelids. That can happen with stress and caffeine too, but if it clusters with sweating and high water intake, think electrolytes.
Practical approach. If you are prone to cramps, focus on steady intake during the activity, not only after.
And pair fluids with some sodium source, especially for longer sessions. Moving to slide 6. Dizziness is another big one. And again, there are many causes. But electrolytes can contribute, especially when dizziness shows up when you stand up or when you go from sitting to moving fast. Sodium helps maintain blood volume.
If you lose a lot of sodium in sweat, or you eat very low salt
while drinking lots of water, your circulating volume can feel lower. That can make you lightheaded, especially with heat.
Some people describe it as a head rush. Others feel unsteady, like their balance is slightly delayed. And it can come with a faster heartbeat, because your body is trying to keep blood pressure stable. A simple self-observation: if you feel dizzy after a long hot day, check what you actually replaced.
Did you just drink water? Or did you also eat a normal salty meal? If the dizziness improves after food with salt and fluids, that is a useful pattern. If dizziness is severe, persistent, or comes with chest pain or fainting, that is a different category. Moving to slide 7. Let's make this more concrete by talking about sweat. Sweat is not just water. It contains sodium and chloride, and smaller amounts of potassium, calcium, and magnesium. And sweat losses vary a lot. Some people barely salt stain anything. Others get white crust on clothes, or a gritty layer on skin after drying. That salty sweater sign is one of the most practical clues you can notice without any lab testing. Heat makes it worse. Humidity makes it worse. Long, steady cardio makes it worse. And so does wearing heavy clothing or gear. Here is the mistake. You finish a long sweaty session and you replace the volume aggressively with plain water, but you do not replace the sodium, so you feel tired, headachy, maybe a little nauseated. Then you drink more water because you assume you are dehydrated. If you are a heavy salty sweater, you often do better with a plan. Some sodium during the session and a normal salty meal after, plus water to thirst. Simple, not extreme. Moving to slide 8. Now let's talk about food, because most electrolytes come from what you eat, not what you drink. If you are eating normally, you usually get enough potassium and magnesium from whole foods. Potassium shows up in foods like potatoes, beans, and many fruits and vegetables. Magnesium shows up in nuts, seeds, legumes, and leafy greens. Calcium is common in many diets too. Sodium is different. Many people get plenty from packaged foods. But if you cook at home, eat mostly unprocessed foods, and intentionally keep salt low, sodium intake can drop fast. That is not automatically bad. Some people feel great on lower sodium. Others do not, especially if they also sweat a lot, do endurance training, work in hot environments, or drink large volumes of water. So if you are feeling symptoms and your diet is very low in salt, that is a major context clue. It does not mean eat unlimited salt. It means your baseline might not match your losses. Electrolytes are not just a workout thing. Moving to slide 9. Let's separate two things people mix up. Dehydration versus low sodium, sometimes called hypernatremia when it is clinically significant. Dehydration is mostly not enough total fluid. Common signs are strong thirst, darker urine, dry mouth, and feeling better when you drink. Low sodium relative to water is different. You might still be thirsty, but drinking plain water does not fix it. Urine can be very pale. You can feel bloated, nauseated, headachy, or mentally foggy. In more serious cases, confusion can happen. Most people watching are not dealing with severe hyponatremia, but mild dilution can still make you feel lousy and can hurt performance. The big risk scenario is long endurance activity, heavy sweating, and aggressive water intake without sodium. Another scenario is extreme water challenge behavior, not smart. So the practical takeaway: if you are sweating for hours, drink as much water as possible
is not a safe strategy.
Moving to slide 10. So how do you actually use electrolytes in real life without turning it into a chemistry project? Start with when you need them most. Long sweating, heat exposure, endurance training, or a day where you are drinking a lot and peeing clear constantly. Next, think in terms of pairing. Water plus sodium. That can be an electrolyte mix. It can be mineral water plus a salty meal. It can be broth. It can be a simple homemade mix, as long as you keep it reasonable. If you use a commercial electrolyte product, check the label. Many are basically flavored water with tiny minerals. For sweat replacement, sodium is usually the main number to look at. Also, watch the sugar content. Some people want carbs for performance, others do not. You can choose based on your goal. And one more thing. You do not need to slam electrolytes all at once. Small, steady amounts often feel better than a big hit that upsets your stomach. If you have kidney disease, heart failure, or blood pressure issues, talk to a clinician before changing sodium intake significantly.
Moving to slide 11. Let's cover a few groups that commonly underestimate electrolyte needs. First, endurance athletes and hikers. If you are moving for multiple hours, especially in heat, you are not just losing water, you are losing sodium steadily. And if you only replace with water, symptoms can creep up late. Second, people who do sauna or hot yoga. You can lose a surprising amount of sweat in a short time. If you stack sessions, the deficit stacks too. Third, people on very low-carb diets. Early on, insulin drops and the kidneys excrete more sodium and water. Some people feel dizzy or weak until they increase sodium and fluids appropriately. Fourth, people who drink lots of coffee or tea and then try to balance it with tons of water. Caffeine is not a dehydration monster, but the behavior pattern can still lead to dilution if you overdo water. And finally, anyone with a physically demanding job in heat. You might not think of it as training, but the sweat math is the same. If you see yourself in one of these, be more intentional. Moving to slide 12. Now the flip side. More electrolytes is not automatically better. Too much sodium can be a problem for some people, especially if you have certain medical conditions. Too much potassium can be dangerous, particularly with kidney issues or specific medications. Magnesium supplements can cause diarrhea, which is the opposite of what you want if you are trying to stay hydrated. So think right amount for the situation, not max it out. If you are sitting in air conditioning and eating normal meals, you probably do not need to sip electrolytes all day. Also, pay attention to hidden ingredients. Some electrolyte products include high doses of sweeteners or stimulants. If you feel jittery or your stomach feels off, it might not be the minerals, it might be the additives. A practical rule: use electrolytes when you have a clear reason, heavy sweat, heat, long duration, or repeated symptoms that match the patterns we talked about. If you are unsure, start small, see how you respond. Your body gives feedback pretty quickly. Moving to slide 13. Let's build a quick self-check you can actually remember. I call it the 3 context test. Context 1. Loss. Did you sweat a lot? Spend time in heat? Have diarrhea or vomiting? Or do a long training session? Any situation where fluid and minerals leave the body. Context 2. Replacement. Did you replace mostly with plain water? Or did you also eat a normal meal with salt? If it was water only, that increases the odds electrolytes are relevant. Context 3. Symptoms. Are you getting the cluster? Persistent thirst, headache after drinking, cramps or twitching, lightheadedness on standing, unusual fatigue, or nausea with water? If you have all 3 contexts, electrolytes move from maybe to very plausible. If you have loss plus symptoms, but you have been eating normally, it might be more about total fluid or total calories. And if you have symptoms without the loss context, look elsewhere first. Sleep, stress, illness, iron, and many other factors can mimic this.
Moving to slide 14. Let's close by making this actionable without turning it into obsession. If you suspect you need electrolytes, start with food first. A normal meal with some salt, plus water to thirst, solves a lot of mild issues. If you are in a heavy sweat situation, Add an electrolyte drink or mix that has meaningful sodium, not just trace minerals. For long sessions, think steady, a little during and a normal salty meal after. For hot days, be proactive. Don't wait until you feel wrecked. If you track anything, track outcomes. Do you feel better? Do headaches stop? Do cramps reduce? Does dizziness improve? If yes, you've found a lever. One subscription request. If you want more practical physiology checklists like this, subscribe. One comment question. Which do you struggle with more after sweating? Headaches or cramps? And remember, persistent or severe symptoms deserve professional evaluation, especially confusion, fainting, or ongoing vomiting. This information is not a substitute for medical advice. Biological age matters more than calendar age.